It's helpful that the order's very good. We've now got Brian from Swedish Match, but all part of the same family now, so it's a logical segue, really, isn't it?
Okay, great. Thank you very much. It's very exciting to be back at GFN. It's been a few years for me, so I've always really enjoyed coming to this meeting. Don't see any slides, so... Which one do you want to look at? There we go. All right, I was going to do some jokes, so this is really good that they came up. Okay, so I really want to build upon what Nizam was talking about today and talk about nicotine pouches at Swedish Match. And the title of my talk today is The Future of Oral Tobacco and Nicotine Products, because, you know, at Swedish Match, of course, you know, as we look forward towards nicotine pouches and these things, we always have to go back to our history, which is, oh, am I pointing somewhere? The Swedish Experience. And so, you know, today I think it's really important to go through the Swedish Experience for a couple of reasons. The first is because I work at Swedish Match and I have to do it no matter what at any talk I give, just because it's what I do. The second is because I just think it's a beautiful example of tobacco harm reduction and really an example of just public health history and things that can happen. And so I want to start with this curve that we've already talked about before, right? This risk cliff, knowing that the non-combusted products are well down below what we see with the combusted products. But the question is really, how do we know that, right? And so when we start talking about this, the Swedish Experience, first I always start with market numbers, right? So the orange line here, you're going to see sales of packs of cigarettes in Sweden, right? And in the blue, that is sales of cans of Swedish snus and later on some pouch products. In 1973, that's when the first pouch Swedish snus really went to market. And you can see that there's an increase from that point on in smoke-free oral products, right? And at the same time, you see a really large drop in combusted cigarette sales. So this is the market level, right? This is really great. You can see that the population is kind of moving from one product to another. That's wonderful, great. But like, what does that really mean as far as what products people are using and the impacts of that change in behavior? And here I have something different. So in the blue, you're seeing the prevalence of Swedish snus use in Sweden over time. And in the orange, you're seeing the prevalence of combusted smoking. This is among males in Sweden. And you can see that the pattern pretty much follows. You see a large reduction in prevalence from somewhere up near 35% in 1980 down to about 5%. And Swedish snus kind of increases over that time pretty generally, but the big difference here is this huge reduction in combusted use. So the behavior change is great, but what is the impact, right? And so in this yellow square, the yellow square is the time period in the box. You can see that heart disease in men over this time dropped. Oh, you know, this is a huge drop in you know, ischemic heart disease, heart attacks, things like that. Really, really important. And at the same time, or in a slightly different time series, this is very delayed. Time for the jokes. Okay, in this one, you can see the rate of lung cancer among men in Sweden. And you also see a really large reduction. So it's not only that the behavior is changing, but we're actually seeing impacts in the incidence of disease in Sweden. So this is really, really, really great data. But at the same time, you might say, okay, so this is going on in Sweden. We know over time in kind of high-income countries that the smoking rate has been going down, rates of disease have been going down. You know, why does this, the Swedish Experience, why is this because of snus? And really, this is the reason. Because if you look at this smoking prevalence across the EU, UK, Sweden is by far the lowest rate of prevalence, right? This behavior change has happened at a population level there to an extent that was not possible in other countries. And at the same time, the incidence of smoking-related disease, or sorry, smoking-related death in Sweden is also lower than all the other countries in the EU, right? So we have real public health impact because of the Swedish Experience. Okay, so at Swedish Match, we're super proud because we got the first modified risk tobacco product authorization from the Food and Drug Administration. And the reason that this was granted was a lot of it was based upon that epidemiological data I was just showing from Sweden. But that's not the only reason. Some of the other reasons were because it was very unlikely that this was going to be taken up by non-users. And one thing that I really want you to keep in mind for a few minutes is significantly lower levels of HPHCs, in particular tobacco-specific nitrosamines, NNN and NNK. These are two potent carcinogens that are real drivers of disease from tobacco products. And what this authorization allows us to do is to speak directly to consumers, right? We can tell consumers that when using general snus instead of cigarettes puts you at lower risk of mouth cancer, heart disease, lung cancer, stroke, emphysema, and chronic bronchitis. So if we think about this scientific assessment pathway, right, starting from you're developing a product, you're doing the toxicology, you're doing the clinical assessment, behavior, and then ultimately the epidemiology of the product, the stuff that takes a really long time, we already have this for snus. We took the shortcut. It only took us like 100 years to get there, but we have this data for general snus. And the way that we look at it is this is sort of our ceiling, right? We know that if we develop our products with a risk profile, with snus as the maximum, that we can have similar health impacts with these products. I don't know where I'm supposed to be pointing. Try there. Okay. Sorry about that. And so with that, I'm going to talk about ZYN. And I'm going to have a particular focus on the United States for the rest of this talk. So I really am going to lose my mind. Okay, so what are ZYN nicotine patches? This is a tobacco leaf-free, spit-free oral nicotine pouch. It's used really very similar to the way that you use Swedish snus. You stick it in your upper lip, you leave it there for about half an hour. In the United States, this is available in 2 different strengths. We have a 3 milligram and a 6 milligram. And we also have 10 different flavors, right? Because we know that in the sort of one size does not fit all, that we like to have a lot of options. People like different things, and whatever we can get people to use instead of a combusted product is great. And we submitted a PMTA to the FDA in March of 2000 for these products, and that is where it is still. Okay, and Nizan has kind of already gone over this, but I mean, I think when we talk about technology and we talk about design, my favorite design is always very simple, and pouches are very simple, but it's very hard to make things very, bare and great. But really all it is a plant-based pouch with nicotine, some fillers, stabilizers, and food-grade flavorings and sweeteners, and that's it, right? Very, very simple product. Really? Oh, there we go. All right. So these HPHCs. So you remember I said that it was the reduction in HPHCs. That was a big reason for being granted the MRTP. So here I have in the green bar, this is moist snuff. This is a traditional American product, right? And in the yellow, I have the Swedish snus. And you can see that the level of TSNAs in Swedish snus is about 80% lower than a traditional American moist snuff product. And when we talk about the amount of TSNAs in a ZYN nicotine pouch, you can see here, but not very well, because it's below the limit of quantification. That means that the level of TSNAs in this product is so low that we can't actually accurately measure it. So already we're looking at a product that from a toxicological risk assessment place, is very low. And, this is only in the moist category, and it's really difficult to compare across kind of routes. But that's kind of a rule of thumb. There's about a 99% less exposure per unit when you compare a combusted cigarette to a nicotine pouch. And this is for the 9 tobacco reg constituents. So, this is great. You want to have low levels of HPHC, but as part of that assessment, we continue and we look at Maybe we need a battery. Toxicology, right? So in the in vitro toxicology, what we do is we basically put extracts from different products into a dish, and we measure how genotoxic, mutagenic, cytotoxic these things are. So this is a pretty heavy kind of graph, but all I really need you to notice is there's black horizontal lines going across each of those, right? Anything below those lines is going to be considered non-toxic. Anything above those lines is going to be considered toxic. And you can see that the black line going straight up, that's a good kind of response from a combusted cigarette. That's what you'd get. And you'd see that on the bottom, all of those lines are for different varieties, flavors of Zyn nicotine pouches. And so from this, we can say that, killing me. Can I just like point at you and you can advance? Maybe? Okay. Zyn pouches do not exhibit mutagenicity or genotoxicity in vitro assays. Okay. So the risk profile of these products is pretty good, right? But one thing that, if you have a product with a very favorable risk profile, it also has to be a product that people want to use, right? And so when the way that we look at that is how well these products are able to deliver nicotine. And Nizan has already showed some of this, but this is a different experiment. And we look at the PK curves. And so the two pink curves are for two Zyn products, a 3 milligram and a 6 milligram product. The middle yellow line there is a snus product. So that's a really nice place to kind of compare them. And the green is for a moist snuff product. And what it just shows that Zyn nicotine pouches deliver nicotine pretty much as efficiently or a little better or a little lower than a lot of other oral nicotine products. So it will provide the nicotine that a user is looking for. And then you remember we discussed different flavors, right? So one thing that a lot of regulatory agencies are concerned about or thinks is that some of the flavors that we put into these products may affect nicotine delivery. And I have 9 different varieties, flavors of Zyn in this PK curve, and you can see that the nicotine delivery is really not affected very much. So the nice thing is that whatever flavor you're using, the nicotine delivery is going to be about the same for these products. So, as another part of our assessment, right, particularly when we go towards the FDA and the PMTA process, is they really are concerned that people who use other more harmful products will switch to these products, but also that non-users will not be attracted to these products and start using nicotine and tobacco products. And so the way we look at this is through likelihood of use studies. And we basically explain the products to people and ask them how likely they are to use them, right? And so in this study, you can see that the numbers on the left are a Juster scale, but current smokeless users are quite interested. Smokers are also fairly interested in these. But the other 2 bars are for non-tobacco users in the general population, and then the rightmost is for our surrogate for youth, which is 21 to 24-year-olds. And you can see that they have no interest in this product. I think that number stands for something like definitely wouldn't use. So that's really good. But again, when it comes to the flavor question, we want to make sure that that doesn't vary across the flavors. And so on the right, I've broken this down by the different flavors of Zyn. And you can see that the results are exactly the same. There's no difference across the flavors. The never-use population and the never-user youth population are not interested in the products, and it doesn't really change for the smokeless or the current smoker. So these are not going to attract people that we do not want into the category. But this is, this kind of study is really just asking people questions about the product. What we really want to look at is how people are actually using the product. So in this study, what we did is we talked to about 1,300 Zyn users, and we asked them about their product use now, what products they used before, how many pouches they use, all sorts of things. And they averaged about 9 pouches a day. About 25% reported that they now are exclusive Zyn pouch users. And starting Zyn, dual users still exists. There's a lot of dual use there, but they report using less of the non-nicotine pouch products. So they're cutting down their use of combusted cigarettes, which I'll get to in 1 second, but also e-cigarettes, smokeless tobacco, hookah, you name it, everything. But on those smokers, so 382 of these subjects reported that they were smokers prior to starting to use Zyn. And so we asked them about, okay, so now what's your how has your smoking behavior changed? And I broke this down here. So about 50% of these respondents stopped smoking cigarettes completely. They're still using their nicotine pouches, but they're not smoking cigarettes. Another about quarter reduced their cigarette smoking by more than 50%, and a smaller percentage reduced by less than 50%. And there was a couple who were unchanged and 1 or 2 who had actually increased their smoking. But a vast majority greatly reduced their smoking after starting to use Zyn. So that's a really positive thing for us. And so I found this really interesting. So we went in and we broke these people down a little more. And okay, so as I've already said, about 50% of this group reported not smoking after Zyn. But we broke them down into how many pouches they were using a day. 1 to 3 pouches, 6 to 9 pouches, or 10 plus pouches. And you could see that those who were using 1 to 3 pouches a day, the percent of respondents who reported not smoking was much lower, right? And it kind of increases in sort of a dose-response manner, right? Those who were using the most pouches, that group had a much higher likelihood of reporting that they had stopped smoking. So, it's showing not only that, it's showing that people are replacing use of other products, in this case, cigarettes, with the Zyn use. It's not adding on to that use. It is not. And if we look at the amount who reduced by 25% or more, or 50% or more, if we add that on to this group, the numbers are even more impressive. One more. Right, where those who are using 10 pouches a day, almost 90% reported that they had either quit smoking or stopped smoking or reduced their smoking by more than 50%. So it's a really nice story, right? We have products that have a reduced risk profile. We're fairly confident that this can work based upon our Swedish news story. But the question remains, are we going to have an American experience, an American Zyn experience? I'm not sure what to call it. And the thing is that we don't know. But what we do have is some idea, right? So on the left, what I'm showing is percentage of the nicotine pouch category compared to the combusted cigarette category. And on the left there, I'm showing it in the Western region because this is where we first launched Zyn nicotine pouches. And you can see from 2017, where it was barely a blip in the sales, to 2022, where it's up at 12%. So that's really great in the Western region. A lot of people, the market is shifting from nicotine pouches, or from cigarettes to nicotine pouches. And if you look at the total US, it's not as far along, but the pattern remains, right? The conversion is happening. So I think we need to give this time, we need to create an environment, and we need to have the right communication that we can really have this thing take off. But there's one more really important point, right? We love seeing this growth. I should note, Zyn is about 70% of the nicotine pouch market. But there's one other thing which I'll never get to. Okay, youth use, right? So youth use, according to the National Youth Tobacco Survey, which is a study done by the FDA and CDC, shows that youth use rates of nicotine pouches are at about 1%, right? This is lower than really almost every other tobacco category. This is a very low number, and the other important thing is that over time it suggests that this 1% has remained stable. So we're very happy with that, but we want to continue working to make sure that this number remains low so that other products are not jeopardized for users of other tobacco and nicotine products who could ultimately switch to nicotine pouches. So in summary, the Swedish Experience is a really good example that this sort of behavior change can happen at a population level, and that change can have real public health impact. Nicotine pouches You know, they're what's next, right? They're an evolution of general snus. The behavior pattern is very similar. They have a more favorable HPHC profile, great tox results, delivers nicotine really well, and we have evidence that users are really switching from other products to nicotine pouches. You know, the market data is showing this shift, and the youth usage rates are low. So that's all from me. Open to questions. Gonna throw this away. Thank you.
Thank you very much, Brian. Let's have some quick questions, even though we're a little bit over time. Julian, and then Andrew. Andrew, do you want to go first? Julian was first last time.
Yeah, just a quick question. Brian, why is it that in the US the products are predominantly low moisture content and in Europe they're high moisture content? Nicotine pouches, I mean.
Right. Well, have you heard of the deeming rule?
Yes.
Yeah. So the products, you know, the market in the US is basically frozen based upon the PMTA process. No new products can come to market right now. So only products that have their PMTA in time are you know, can remain on the market while they're being reviewed. So the US market has not been able to kind of adapt to those changes that we've seen in Europe.
Okay, so if you added water, you need to resubmit a PMTA.
That would be a different product, yes.
Yeah, okay.
Julian.
Merci beaucoup. So Julien Lacourrier, Ventus Medical. I forgot to introduce myself before. Given the fact that the whole objective of this is to make it a global, massive success, you would tend to agree with me on that one, right? What are you going to do to address the behavioral change that any sort of new switcher will have to go through in order to adopt this? So if I'm a smoker, right, I get my kick within 3 minutes. I need to switch to this, which is a totally new behavior. What are you doing to address that? How are you taking people by the hand to get that? It's not a scientific question, but it's a fundamental question for adoption. And yes, the PK curve is good, but you know, you still need to walk people along the way to make it use it.
Yeah, and I agree. I mean, I think, you know, just based upon the route of exposure, you know, things are quite different, right? You could probably design a pouch at some point that would hit like a cigarette on a PK basis. That does not mean that the experience of using that pouch would be very similar, and it might be rather upsetting. I think that would be quite a hit to the mouth, right? So it's really, it's quite a different product. I think, you know, education about the format and about the category is really important. I think there's a lot of at least in the United States, and I'm sure other places, of baggage around the oral smokeless category, right? People are familiar with chew, with moist snuff, and it's in the teeth, and people are spitting, right? And I think that could go a long way there. And of course, it's continuing to develop formats and technologies that allow us to get a PK curve and a nicotine delivery that can really satisfy someone who's used to a combusted cigarette.
Another question down here.
Hi, I'm John Oyston. I'm a Canadian physician. Thank you very much for the presentation. I think it's exceedingly important that we properly understand the Swedish experience, particularly in countries like Canada, where no nicotine pouches are currently authorized. I'm a little confused by some of the graphs you presented, because it seemed between 2000 and 2020, sales of nicotine pouches went up dramatically, but the actual prevalence of daily use hardly changed.
Okay, that prevalence number was among youth.
Okay, you have one graph which shows cigarette smoking and snus use, and daily use.
Yeah, sorry, the sales data was for the United States.
Oh, okay.
So that the snus cigarette data was for Sweden.
Okay, thank you.
Yeah.
Thank you very much, Brian. And Julian, thanks very much for asking that question, because I think that's a huge issue as regards, you know, people putting something in their mouth rather than they're used to sucking on something. Anyway, thank you very much, Brian. I thought it was extremely interesting, and we're due to start again at 20 past, so sorry I've eaten into the coffee, but I think it was worth it to hear those two.